Staying with COVID-19 news, the Gauteng Health Department has opened a further 35 vaccination sites in the province. It's as phase 2 of the inoculation drive, targeting those over 60, increases speed. The province now has a total of 63 sites across regions.
As the mass vaccination rollout program enters its second week, the Gauteng Department of Health today has added new vaccination sites to ensure that more people who are 60 years and older can get vaccinated. This move by the department increases the public vaccination sites in Gauteng from 28 to 63 sites spread across the 5 regions of the province. As of Saturday, the 22nd of May, over 40,000 people were vaccinated at all age homes and health facilities across the province. To date, over 160,000 people, including healthcare workers, have been vaccinated, with close to 400,000 registered on the Electronic Data Vaccination System. All residents are urged to help reduce the spread of the pandemic by getting the COVID-19 vaccine when their turn comes. However, the public is urged not to visit vaccination sites until they have registered and received the SMS advising them to do so.
Well, former Independent Electoral Commission Chair Dr. Brigalia Bam received her COVID-19 vaccine shot at the FF Ribeiro Clinic in Sunnyside in Pretoria. Bam is among the group of senior citizens heeding a government's call to register on the Electronic Vaccination Data System for their shot. It's happening as the calls, of course, for the IEC to postpone elections continue to gain momentum. Well, let's bring her into this conversation. Good evening, Ma'am Brigalia. It's such a pleasure to be speaking to you after such a long time. Firstly, tell me about the process about getting vaccinated. How did it go today?
It was wonderful, really. It was wonderful because I was looking forward so much to it. Extremely impressive by the way they've set up everything, by their professionalism, and there were a number of us, and they planned everything so very well. What I liked best was the information that they give you, and I find it very helpful because you have to know what is going to happen after you have taken this, what is to be expected, and that I found very, very helpful. Of course, I couldn't help thinking, how on earth are they going to cope? I was looking at the numbers. How are they going to cope with the rural areas? And thinking of all those other women of my age, you know, us the old ladies, is going to be quite a challenge to the department, but so far, so good.
We've heard some of those that have gone through the process talking about how it requires quite a lot of administration in terms of the paperwork that you need to fill before you actually receive your vaccine. Was that your experience today?
Well, maybe perhaps it's because I was expecting it, and I couldn't help thinking how difficult it must have been for them to set up all that system, because they have to record so many things, unlike elections. With elections, somebody gets into the line. After getting into line, you know, the process is much, much easier and less complicated than theirs. But in spite of that, I think that because their line is so clear, you know, the phases where a person goes from one place to the other, I think that's impressive, very impressive, because it's not as easy. Well, I don't imply that the elections are more difficult, but it's not as easy as elections. You know, there are so many things that they have to be careful, the distancing, they've got to make sure that it's done properly, they've got all the forms right, and they give a lot of information, which I found, and I repeat again, extremely helpful. Yeah.
I imagine that it's come as quite a relief to you to be able to get your vaccine right now. It's been a year of anxiety and concern. Speak to me about perhaps from a more personal experience of what this past year under COVID has been like for you and the precautions that you've had to take in your own life.
You know, I don't want to exaggerate, because every time I was very, very anxious, and every time I was bored, and every time I knew I was going to receive the news almost on a daily basis of someone you know, and you can't bury these people. You can't visit them in hospital. it has been for me on a personal level the most challenging time, as it has been for many, many of us. And what has been also very, very trying is to know that, yes, I am a privileged person, and I thought of many others who are not as privileged as I am. And it has made us to think, all of us, including me, whether we need to rethink the way we all live, because we all value our life, no matter how poor you are. Life, we all value. And so these thoughts were going through my mind almost every day, hoping that the others also are able to survive in spite of the challenges that the others were facing. I suffered also from a lot of guilt, very heavy guilt of those who are not as privileged as I am.
For people who are still apprehensive about the process of getting inoculated, what do you have to say to them tonight?
Well, I have to say to them, when people are sick, you know, it has always been like that anyway. When people are sick, they are given medicine. And this is what happens in the world. And everywhere in the world, everybody tries to prevent all forms of illness. And there isn't always a guarantee, but everybody works on hope. I think that it is wonderful that we have this privilege as South Africans, that we have a government and we have professionals who are sacrificing their lives to make sure that we get this vaccine, because everybody is needing to get the vaccine, because there is no other way. There is no other way. We have to try everything. We have to try everything. This is the first time in our history of humankind that we're all faced with it. And there's no way people can sit and do nothing about it. And so the vaccine is a step that we have to take. And so I really want to encourage people that let's try everything. Let's try everything. And let's appreciate the efforts people are putting into thinking, into researching, into sacrificing their lives to make sure that a solution is found. I think that it is a very good thing that South Africa has managed, after a big struggle, to bring it to our country. I'm proud of this country.
Sure. Ma'am Brigalia, you know, just earlier you were talking about being in the queue, going through the process. I suppose it's not surprising that the first thing you compare it to is elections, because that probably still runs in your blood. Of course, we're also...
It does all the time.
Of course, we're also at a situation now where, as a country, we're contemplating the local government elections, which are scheduled to be held in October. And I know that you've probably had some reflections in terms of what the challenges might be given the current climate of COVID-19.
Well, I must say that I think about it all the time, and sometimes I enter into conversations with the colleagues. And three things are in my own mind. One is that in spite of everything else, the Electoral Commission should continue to prepare for the elections and not wait around. Because the experiences of other countries are not the same as ours. And our biggest challenge has to do with those people who don't have access to technology. And that really is the biggest thought. What I say, how are we going to manage with that? And the second important thing I think we have done is to get an outside person, very experienced, lots of passion, Judge Mosineke. Judge Mosineke belongs to the group of people who performed the 94 elections, and I refer to them as a miracle of the elections. At a time when there was so much violence, so many killings that were going on, and they were able to prepare and focus in that environment. And then we were also sent, some of us, to Zimbabwe. And the environment was not, of course, death, but it was death in the sense that of the violence. And I think that the real challenge for us is how the systems can be set up, especially in the rural areas, for people, and also in our informal settlements, that we make sure that we can guarantee all the requirements that are there. It is a worry. It is a worry, but in spite of that, it doesn't mean that we have to sacrifice lives, because we can always run the state. And that, to me, becomes the key thing. That becomes a priority. What does it mean to people's lives? That's our priority.
There are concerns from certain quarters of the country who say, well, if we don't have elections this year, it will be breaking a precedent on the one part, but also setting what could potentially be a dangerous precedent going forward. Do you think that it's that plain in terms of identifying the issue? Do we have to see it as the two being diametrically opposed?
No. Listen, the country will not stop functioning if we do not have elections. Let's get that very clear. And we must look at that. What is important, most important, is people's lives. The minute we are clear on what is a priority for this nation and where we stand beside the fact that we all want to go to elections, we have to follow the Constitution. We have to understand that the Constitution was drawn for normal times, and none of us ever thought we could have this in the world when people were drawing up the Constitution so they could make provisions. And I don't think that if South Africa postpones the elections, it is the end of the world. It is not the end of the world, because there were countries who had to postpone elections when there was war. So there's nothing really about it. I think we have to think about it, and the priority is to do elections with all the difficulties of campaigning, with all the difficulties of distance, and think about people's lives. This is the only way in which we can make the decisions. All the other concerns people have about who's going to be in power, whether we are going to rule the country, we are the last lucky ones who will be there. To me, those things are very minor, because we are talking of life and death.
Former chairperson of the Electoral Commission of South Africa, Dr. Brigalia Bam. Brigalia, let me thank you so much for your time tonight.